Welcome back to KHKZ's Texas Live. Well, joining us in the living room now is Mariana from CHRISTUS Trinity Mother Frances Rehab Hospital.
And today she's going to tell us about National Rehab Week. Good morning.
Good morning. Thanks for having me.
No problem. So what is National Rehab Week?
National Rehab Week is a week that we get every year to celebrate our heroes, our therapists, our staff that helps our patients get better, and especially our patients that work so hard, that come to us after an illness or an event, and their goal is to go home and go home safe, as independent as possible.
So kind of tell us about the patients that you all are seeing at this hospital then.
Right, we see a wide variety of patients of all levels. We see stroke survivors, patients that have fallen, hip fracture patients, patients that are debilitated, maybe after an illness or an injury, even patients that are falling at home, maybe debilitated, not safe. We can bring them in and rehabilitate them so they can go home and be safe.
Yeah.
So a couple of associations have actually recommended, if you've suffered from stroke, to go in and doing this rehab because it'll help you recover better. Could you explain that a little?
Absolutely. The American Heart Association and American Stroke Association issued a press release in May, and they recommended that an inpatient rehab hospital is the best place to come and get rehabilitation.
So what is this hospital? How is it set up? I mean, how is this going to work when the patients come in? What kind of service, I guess, can they expect?
Sure. Well, we are an actual hospital. We're not a nursing home or a skilled nursing facility or even an express rehab. We're an actual hospital. So they get a higher level of care in addition to getting 3 hours of therapy per day. So it's very intense therapy customized to their condition that gets them better faster.
Yeah. So some folks out there might not realize, how this therapy works or how tough it may be to recover from a stroke. How difficult is it for patients, who had suffered a stroke to recover from that?
In our setting, it's always a challenge to get better after a serious event. But we have a multidisciplinary approach, and that's physicians, therapists, nurses that actually customize therapy to their condition. So we make it based on their ability and on their goals, and it takes hard work from everyone, but we have amazing outcomes.
I was going to say, what do you think sets you apart? I mean, you guys have been nationally recognized. How did you reach that status, I guess?
Absolutely. Well, we do have a higher level of care. We are, for 10 years in a row, the top 1% in the nation for patient outcomes. So right here in Tyler, we are a leader, and basically what that means is we get patients better, faster, and we just have a very focused approach with our patients and their families. We teach them how to continue their recovery once they leave our hospital.
Yeah.
So how important is it to you, or how does it feel to see these patients come in and you help them and then leave, in much better shape?
No, it's great because a lot of times they come in and it's, they've been through a lot, and we work with them very closely. And when they leave, it's a celebration. We call it their Independence Day.
Yes, I love that. Okay, thank you so much.
Yeah,
Appreciate
thank
it.
you.
Up next, we're dealing with some unseasonable